This video will demonstrate the steps necessary to perform pleural decompression of the chest. This skill should be reserved to patients exhibiting signs and symptoms associated with tension pneumothorax, including absent breath sounds on one side and indications of hypoperfusion. Other indications include distended neck veins, tracheal shift, altered mental status, difficulty in ventilating the intubated patient, and subcutaneous air. This skill should not be performed on patients with a simple pneumothorax or tension that can be relieved by removing an occlusive dressing. The device used in this demonstration is for instructional purposes only. A device that is large bore, 12 to 16 gauge, at a minimum of 2.5 inches long should be used. It is important that the EMSP ensure the flash chamber cap is removed prior to insertion. For specific recommendations on insertion techniques, please refer to your medical director or training officer. Begin by taking appropriate body substance isolation. Ensure that the patient's airway is being managed and that supplemental oxygen is being provided. Assess for signs of tension pneumothorax as stated previously. The EMSP will begin by selecting the appropriate equipment to include 12 to 16 gauge over-the-needle catheter, minimum 2.5 inches long with a flash chamber cap removed. For this demonstration, we will be using a 3¼ 14 gauge over-the-needle catheter, Asherman chest seal or one-way valve, antiseptic solution, 4x4s, and tape. Identify the appropriate location to perform the decompression. This can be done by finding the second or third intercostal space on the mid-clavicular line of the affected side. You may utilize the angle of Louis to mark the second rib or begin counting down from the clavicle. The second intercostal space is located between the second and third rib. The third intercostal space is located between the third and fourth rib. Ensure that you identify the correct anatomical site prior to insertion to include appropriate intercostal space, mid-clavicular placement, and affected side. Properly cleanse the insertion site with an approved antiseptic solution. For this demonstration, we will be utilizing ChloraPrep. Reaffirm the correct insertion site. Seen here, we will be decompressing the second intercostal space, mid-clavicular, right chest. Place the needle on the superior border of the lower rib and insert into the skin. This is done to avoid intercostal vessels and nerves. Raise the needle to a 90-degree angle and insert needle while listening for a rush of air. Advance to hub and remove the needle. Place sharp in appropriate container. Stabilize the catheter in place with tape and ensure to not cover the opening of the catheter. Place a one-way valve if available. If not, leave catheter open to air. Reassess the patient's breath sounds, blood pressure, and pulse. Monitor en route to the receiving facility.